No, my sister keep texting me.
Do you need to see it?
No, just like mute it.
How do I mute? Wait.
Yeah, it's giving.
She knows my phone. Like she actually knows
Do
my
I
password.
know your password? I think I already forgot it. I can see your fingerprint.
Bye. I love that little face
Okay,
ID.
mute.
Yeah, thanks. Okay, sorry. That's really. Hello, everyone. Welcome to our first episode of the Sci Huddle. I'm Farah. I'm part of the Health Sciences Student Association, and part of why this podcast started is because we wanted to showcase health sciences students, their projects, what they're passionate about, and their daily life. So for our first episode, we have
Salwa. Hi guys, I'm studying nutrition and food science here at the U of A. I do a lot of community work and like health-based research, and a lot of the things I care about are like public health related, so health equity, just like community culture around healthcare and the workers, and it's like the invisible causes, like healthcare outside of the hospital more or less is what I'm mainly passionate about.
Yeah, and today's episode is going to be about health equity. So today, for our first question, I'm going to ask Salwa, what is health equity? What does that mean to you?
Okay, health equity is like a term you hear all the time. I feel like it's talked about since you're little, equality, equity, the differences. But health equity is pretty much the principles that gives everyone like the fair opportunity to good health. And that involves economic, social, physical factors. Like it's more than just being able to walk into a walk-in clinic. And then like health disparities on the other hand are like measurable differences that affect people's health statuses that are unavoidable. And that's the issue. They're unavoidable based on societal measures. Like things like systemic racism, unfair systems, just like money in general. Like that's pretty much what health disparities are. There's something called like a health gradient that I learned about in class. And pretty much it's like a chart and it's like the more money you get, the more healthy you get. And then when I really thought about that, that's kind of scary. Because it's true, like money does make a big difference, and having access to healthcare makes an even bigger difference in someone's life.
Yeah. And I guess you touched on it as well, but like how does health disparity affect the patient but also us as students in health sciences?
Well, it affects you at in every aspect of health. Because if there's no health equity, then there's people who are left behind, more or less. So a good way to think about it is like that one image that I've seen a bunch of times, and it's like everyone trying to ride a bike, but it's like one bike, it's like the standard bike, and then there's one person in a wheelchair, there's a pregnant woman, there's someone way too tall, there's someone way too short, like, because not everything is like a one-fits-all matter, but that's kind of how the healthcare system works at this very moment. So I feel like when it comes to like health equity, like a lot of people don't even think about the external factors that affect health. Like, can you book time off of school to go to the dentist because you have a toothache, and then you just push it back until it becomes something worse? Do you have like transportation? Like, do you have to bus 40 minutes to go to the doctor, or can you drive there in 5 and just go whenever it's convenient? Like, all of those factors really do affect health equity, and those are a lot of things people don't verbalize. Like, it's something we all, I think, subconsciously understand, but it's not something we talk about often, you know?
Yeah. Interesting perspective from a student as well. Yeah, I think having a rigid like school work does not allow us to take time off for our own health could also be
that plays a big part into health equity. Because it's not just like a patient issue, it's more of like a systems issue. And then especially as like health science students, like you're in nursing, so like training is an issue, you know, like the way they train you to become healthcare professionals, it's like a lot of people and students they face the same barriers that the patients do. And then technically we're not a patient, so people don't really think about it like that, but like the same problems that cause bigger problems are things you're dealing with now, more or less. And I feel like as students, people are like, oh, I just have to work hard, I have to be more resilient, I just have to like push through things, but a lot of things are solvable on a small scale with the right community supports, right access, the right permission, but I feel like we don't talk about things like that. Because I know like a lot of people in like my peers, like they'll neglect their physical and mental health for school. Back to what I was saying, like health equity is more than just like an issue that affects patients, because it affects providers, it affects professors, students, like anyone. Because healthcare is like very layered, because you know there's the caregivers, the care receivers, and there's everyone in between. Like a lot of people don't think about like all the jobs we don't think about, like LPNs, and then like the people who push people in wheelchairs, and people who like even the maintenance people at the hospital. They're so nice guys. Like literally say hello to everyone while you're there. Literally say hi to everyone while you're there, because you never know. Everyone works really niche jobs, I met a
That's true.
phlebotomist once, very fun. But that's not what we're talking about now. So
Yeah. Adding on to your point about mental health and like not being able to take time off to
Take
seek
care of
that,
yourself.
yeah, to seek that like support that you need. That's very true. Because like in the Health Sciences Student Association survey that we launched, like we found that like a lot of students do think that their placements are too rigid for them to be able to take time to take care of themselves, which I feel like is the basic
yeah, and I feel like
minimum.
it's more programs than others for
For
sure.
sure.
Like everyone I know in nursing has horror stories from placements. Whether it's I've heard of violence on shift.
Yeah.
When my friend was working at like a psych rotation once, that was terrifying to hear of, and things like, oh, like if I miss my placement, I'm gonna be held back a year. Like that's kind of
True.
extreme. Like I understand the importance of attending every placement, but I feel like situational issues and missing school is not end all be all. But some people act like it is.
Yeah.
And a lot of people can't afford to like miss class. A lot of people can't afford to mess up. That's the thing. Because we're paying so much for our education, so to do badly is like, there's a lot on the line.
For
All
sure.
the loans you took out, sometimes it's like familiar pressure, internal pressure, external factors.
Yeah.
Like if you're in uni, you're gunning for what you want to do, you know? So a lot of people don't have that.
Yep.
A safety net.
And also, like having work outside of school and having to balance that with a full course load and with training, that adds like extra levels of barriers that can cause lots of health inequities amongst different, even types of students, different like students
Yeah.
in different programs.
Exactly. Because not everyone can afford their books. Not everyone can afford like Apple devices. Like a lot of people, they break their thing once in uni, they'll never replace it because they don't have the time or the money or the resources to own them. And that puts everyone at different playing fields, and that is literally a health disparity. Because disparities can be in every aspect of life: economic, social, physical. If you were to be like physically handicapped, like anything. So all of these do play into the bigger picture.
Mm-hmm.
And I know everyone says like, oh, like things are equal. Life is not equal. University is not equal. Everyone has different opportunities, different chances. So I think it's like really important. Like I know it's like in public health they like to call it like the world like a wicked problem. There is no easy solution to any of these problems that we'll be talking about today. But understanding that it is like a multi-layered issue is like the first step. Like comprehending the situation so you can just adjust accordingly, like the small things. Because I think small change is better than no change, 100%. And I'm not very big on the, oh no, it's the end of the world, like there's nothing I can do. There's so much you can do always.
I love that message because, yeah, I think at some parts of our education we lose track of it all and we feel like very helpless, especially like a lot of issues that are happening. So that's a really good message. I was gonna ask, what is the relationship between like environmental factors and health disparities and how that ties into what we just talked about?
Okay, I love this question actually. So in the eyes of public health, like health is outside of the hospital. At least that's what I like to tell myself. All of the steps and things you do every day is what determines your health. So like, I don't know how to explain this honestly. So like a good example is just like food deserts. Like a lot of people don't think about the politics and how that affects food. So I'm taking a public health and population nutrition class, and honestly very enlightening. Like a lot of the topics I'm like, yeah, like of course I understand, but going into depth in a way I'm like, wow, I did not think that was a thing. So we live in like a grocery store monopoly, which is like really like when you hear that you're like, okay, whatever. But so pretty much like a grocery store can own a plot of land for like a significant amount of time and no one else can like open up a grocer there. So that's why we have like a lot of like 75% allegedly of our grocery stores are just like big names, Sobeys, No Frills, Loblaws, like those bigger food distributors, and then a small amount is just like independent grocers that you see on places like White Ave. Like there's a Caribbean food like fruit place. I've never been, one try, that's why I mentioned, but what's it called? But there's like regulatory actions and like legalities. So like there's like the Covenant Bureau, I think it is what it's called. It's like a government facilitated thing, and they're trying to like fight against legally like these land things. Because imagine you're like, okay, I'm opening my stall, my lemonade stall, no one else can be on the street. You're the only option, and that's not fair for a lot of people. And that's why the neighborhood of Grease Spot has like one grocery store, if you've noticed.
So what does that have to do with health disparity?
Well, it's an environmental factor. Food is a really big issue because if you're not fueling yourself, I think it's like my internal bias because I am studying nutrition, and that was my first example. Because if you're not fueling yourself, you're not sleeping well, you're not eating well, you're not like these do affect you and do take tolls on your physical health. Because if you can't afford food or if you're traveling far for food, because some students I know they have to take like 2 buses to get groceries, and they're like one person, so they just have to pick what they can physically carry to bring back because they don't have a car, they live on campus, adjacent to campus. Like that does take a toll on you because not everyone is like lucky enough to come home to like a cooked meal from a family member or like having groceries they don't have to worry about. So I feel like that is a really big like thing for students. It's just like my one example because your environment does shape your reality. And it's more than just food. It could be like physical health services, mental health services, your location. Because I know some people on placements, like I have a friend who lives in Beaumont and she doesn't have a car, so she has to wake up at like the crack of dawn, 4 a.m., gets to Millwoods Transit by like 5, has to wait for the bus, and then she has to like, go all the way to Misericordia Hospital, which is west for context, so that's like 3-hour commute in the morning to get to a placement. That's like egregious in my mind, but that's kind of how things are. Like, you know what I mean? Like you have to deal with the circumstances you're in more or less.
Yeah.
And I do think that is like an environmental factor of health disparity because that takes a toll on your body. You're probably skipping breakfast because you're in a rush in the morning. You're not sleeping enough. You're chronically stressed because you're like, oh, am I going to make it on time? Am I going to be penalized? Because, you know, you can't be late to like a nursing placement. Exactly. So like all these things, like it doesn't sound like they connect, but if you like zoom out a bit, like everything does connect more or less.
Yeah, adding on to that food idea as well, like coming from a sustainable development goals perspective, which I know is also like very
academic.
Very academic, very public health related, which is something actually I've been really looking into on how like the sustainable development goals all connect to each other and how that affects us as humans and how that creates a patient or creates like the risk factors that bring a patient into the hospital. Adding on to your idea of like having accessible grocery stores and affordable food, also, like if you think about it on reserves and on like northern territories where there is no affordable food options, I feel like that's a huge thing that I've been like really interested in looking at because truly those are the like foundational social determinants of health that 100%. Bring in people for like cardiovascular diseases and respiratory issues and like highly processed food or highly processed meat specifically, and like can just predispose to all these things that can bring in a patient into the hospital. And then bringing in that idea of like not even having access to a hospital because of where you live.
Exactly. Or then only having one doctor in like your makeshift hospital. That's really common up north because I know like the province of Nunavut, so that's like none of it. Like that's like the proper term. Like it's like all of the up north region. Yeah, I know. But a lot of people they don't have access to proper groceries or inflated prices. Because imagine walking into like your local like superstore and then like something is like 3 times the retail price that you're used to. Like that's horrible. That's so painful. And I feel like a lot of people live in that reality, and that's like a sad thing, 100%. And that's why I definitely believe in like living on the land like 100%, like the fishing laws and then the hunting laws. I feel like the indigenous communities should not be regulated the way they are because of the positions we put them in. And also with lack of groceries, like proper groceries, a lot of people will go to convenience stores or gas stations for food and then eating something like beef jerky more often than you should because it's like an easy protein source could definitely lead to cardiovascular health and issues. So everything is like all health problems they do start on the lower level, 100%, just like your basic environment. But then also like epigenetics are like a really big issue because you know like the residential schools, like we starved those children to make our Canadian food guide. And that's something a lot of people don't know is that it was an unethical experiment. It was done to see how fortification of food worked because a lot of our food in North America is fortified, like our cereals and our snack products. So they starved them on purpose. We got inconclusive data so that they like harmed them, and then they get like the thin, fat, thrifty genotype thing. So their body is more it's more likely to be able to survive starvation now, and then that's passed down to their children. So now their children are like insulin, like they're not like insulin sensitive more or less, and then that leads to like obesity, heart issues, and like so much out of their control. And that is like health inequality at its finest to me, because it's genetic. Like you can't change it, but you can plan around it more or less.
For sure.
Sorry, that was really niche.
No, that's cool. That's really cool. I got to learn something new, and that's horrendous to think about. I'm wondering if you have any other examples of like.
So many, to be honest, of like environmental health disparities, because things like environment, policies, food, transport, like all of this like determines someone's health more or less.
Mm-hmm.
So like housing insecurities, like a lot of people they're busting. They're working real hard to pay their rent while they're in school, and it's like really hard to find like housing close to university that is affordable. And then some people they have to put like rent above all else. So the whole concept of like heat or eat, like are you gonna have somewhere warm to sleep or are you gonna have something to eat at night? And to be honest, housing is more important than food to that extent because we do live somewhere cold. We live somewhere cold. You want a house over your head, regardless. So that is something that I think is really sad, and I feel like. If you don't have a place to sleep, or if you're living somewhere overcrowded for money's sake, like with like the 10 roommates, I've seen people in those positions. Like your sleep is going to be worse, your chronic stress is going to be a lot higher, and then that's going to affect like your focus, your physical health, your mental health, especially because that's just like something that a lot of people take for granted. Like I'm very lucky. Like I have a nice home I can go to right after school, and I don't have to think about it. But that's not everyone's reality. And things like climate change, I feel like I'm not like the most well versed in it, but it's something that like we should all start to think about because our winters are getting colder, our summers are not as hot anymore. Like that affects things, especially because we live in a place where like forest fires. Like in the summer, there's always smoke outside for like 2 weeks, and if you had like asthma or like some pulmonary, like issues, like that's gonna affect you more than others, and just like
and especially like Canada's been very affected by that because of British Columbia's like increased wildfires, and even in Alberta I feel like there's a lot that we can talk about here, and just seeing how that creates this environmental racism where the people who are already the most like dealing with the most social determinants of health problems
100%.
are more even marginalized with climate change, like people who are on reserves who do not have access to clean water, or people who just live in like lower socioeconomic
areas.
Like with low socioeconomic status and like living with not very proper housing conditions, that exacerbates all this, and it creates this like wider gap. And also your point about our winters are getting colder and our summers are not as hot anymore. Can you elaborate a bit on that?
At least personally, I feel like the winters are getting colder. Well, like I feel like 2 years ago we had like that record-breaking winter, if I remember correctly. And honestly, if you don't have like proper housing, like it's safe to assume you don't have proper winter gear. Getting a good coat that keeps you warm is like $300. Having nice gloves and you're not gonna lose. All of those things really do affect us, whether we notice it or not. And I feel like in the future years we'll start to notice it even more because of the trajectory of climate change. So pretty much everything I mentioned here, so like access to travel, access to food, access to housing, how climate change affects like housing, environment, even like policies, like these all play a really important part in like health disparities that affect us on an environmental factor. Because the realest thing to you is your environment, the thing you interact with every day, like that shapes a lot of who you are. So that's why a lot of things are very situational. And I know we talked about students a lot in our environments, but this does affect the patients as well. Like the same thing that we face now in this level of adulthood, older people are experiencing on like a different scale for sure. So I feel like it's really important to understand how things affect people, because you can't give adequate care without knowing the full picture. Like it'd be crazy if you're like, oh, you tell your patient to do X, Y, and Z and they don't have access to X, Y, and Z. You know what I mean? So it's really important to take everything into account when giving care. And I feel like it's really important for us to like integrate into like our future careers. Like it's something very important to know from the start.
Oh, absolutely. Well, I think we're gonna end this episode here for the sake of time. But there's gonna be another part with Salwa, so stay tuned for that.
Yep.
And thank you so much for listening and watching.
Bye everybody.
Bye.